And for me, my personal definition of severe fever is 39 and above. Yeah, between 37.5 and 39, your baby is sick, but at least that is mild to moderate.
Let me tell you, actually, after I had my personal experience with metronidazole,
Yes.
and this is not saying that it's a bad drug, it doesn't work. It does work, but I think I used to dumb down a patient's experience. Like, oh, it's not that bad.
For my firstborn, it was the ghetto.
Yeah.
It was the absolute ghetto. But when I had my secondborn, things just turned around.
You're right.
Less than a minute later, my water breaks.
Hey.
Guess what one of the nurses says? Amejikojolea, leta kitambaa.
I think my advice might not be so good, but I would actually say be a difficult patient. I find that
Advocate
difficult,
for yourself.
Yeah, difficult patients get
Yeah.
more care from nurses and doctors than the ones who are calm and quiet.
Hi guys, welcome back to A Dose of Health, a podcast where I give you not too much, not too little, but just enough health information to make you make an informed decision. Leo imekuwa word salad. My name is Dr. Hope Simiyu, and I have one returning guest, a new guest who will become a returning guest, and I'll allow them to introduce themselves the way they want to.
Thank you. I'm so excited to be back. Can I please be here every season?
Yeah, I'll put your chairs over here. Just pet.
Hi guys, my name is Dr.Dee. I am a medical doctor. I am a mom of 2 beautiful toddlers. I am also a breastfeeding advocate. Hope you would say champion,
Champion.
but advocate is just fine. I am also very passionate about motherhood and community, and that's why I really love these conversations that we're having.
And I think they love you too.
Oh,
Because it just
thanks.
seems natural
Thanks,
for the
guys.
both of you.
Thank you.
Well, thank you for inviting me. My name's Dr.Olivia Gathoni. Introducing myself, let me try. I'm a medical doctor as well, so it's such a privilege and honor to be here. Thank you so much for inviting me.
Thank you for honoring the invite.
I call myself a child health advocate as well. I love all things to do with pediatric-based medicine, especially newborns. That 0 to 1 year is something that I feel we need to support families, fathers and mothers a lot more on. So that is, I think, the area of basically neonatology that I really, really love. I'm a wife and a mom to 2 boys. And I think that's about it for me.
Wow. And she's medic mama.
Oh yeah, my handle
Yeah.
is the medic mama.
Welcome, guys.
Thank you.
Lovely to have you here. It's the end of the day, but guys, we still have so much energy.
There's a lot of energy.
Yes.
Sana.
So where are you guys? Okay, no, Ngendo knows this. So I usually do a journey to inside out. And I just want to find out, where are you emotionally today, right now?
Go ahead.
I go first. So because I'm an avid watcher, I was like, yes. I have my answer already. I think, let me just give the general, how I'm feeling generally. I'm feeling hopeful, which I think is a very interesting emotion for me, because so much is going on that I'm trying to just find that, the silver lining that they talk about,
Yeah.
right? So I'm feeling hopeful, but I'm also trying not to be too expectant, but still being positive. Yeah, that's where I'm trying to be right now.
You're welcome. Yeah. If you know, you know.
Yes, we know. Us, we know. We know.
It's funny, the last time I was here, I was feeling hopeful.
Yeah.
I think today, and I don't know if this is an emotion, but I'm calm. I'm calm because I have been forced to be calm. There's been a lot that's happening, and not that I'm not hopeful,
Yeah.
but it's just like that in between of being hopeful and just being absolutely devastated.
Yeah.
So I have found my middle ground.
Okay.
Yeah.
Okay. With me, there'll always be that kahufu. Even if it's down here,
I know.
it'll always be there. For me, hey, what word can I use? Because it's the last episode of the season. I don't even know what word to use. Grateful, thankful. Because I feel like it has gone better than I had anticipated.
It's gone wonderful.
Yeah.
Yeah.
Oh, I was told, by the way, actually big up yourself.
Yes.
Yes.
Yeah,
I
you've done
was
so
waiting for
well.
you to say you're proud.
Oh, I'm
Be proud of yourself.
Yeah, you've done so well.
2 seasons.
I'm so happy for you.
Wow.
Thank you guys. And I feel like I've really enjoyed the conversations.
You
Like,
have.
the ones that I'm just like,
And we can tell.
Yeah.
Yeah. And then I
It
was told
shows.
I look a bit more comfortable, which
Yeah.
is nice.
Yeah.
Yeah, so let me say proud. Proud
Yeah.
and grateful.
Wonderful.
Yeah, I'm trying to look for gratitude in even the littlest of things these days. And I feel like it does change your day.
Yeah.
And especially in the morning. If you wake up with a heart of gratitude, it changes the trajectory of your day.
Okay.
And it doesn't mean that problems, won't happen.
Yeah.
There's this, my sister sent me this TikTok at hey, problems, just give me a break. I know I'm your loyal customer. Like, Jamini, relax.
Loyal customer.
Yeah, imagine. And I was like, I'm not claiming it, but imagine it's true.
true,
Sometimes in
yeah.
life, there'll always be problems, challenges, but finding the gratitude in even the smallest of things, it's like a glimmer of hope, and it's so beautiful. Yeah, so that is me
Amazing.
right
Great.
now. Thank you, guys.
Yay.
So now, medical jargon, because we are a bunch of doctors.
Yes.
What do you want to decipher for my audience today?
I have one for myself,
Okay.
and then I have one I'd like us to share.
Okay.
The one for myself is for all my mothers to small babies. What is a fever? Let us define what a fever is. Now, I'm saying this with all the love in my heart. Please, your baby can be warm. Your baby can be warm, but if you put a thermometer and it's not over 37.5, it is not a fever.
Okay.
And anything above that is a fever. And I'm not contesting it.
Yeah.
But it's when somebody comes and tells me, Doc, my baby has been having fever, it's 37.1, then it's 37.2. And I'm like,
You are, like, where did you get the figures? Me, that's normally the question in my head.
No, they
If
measure
you have
it.
thermometer.
Yeah,
But then
where
they
did you
tell
get
me.
what made you feel like 37.2 is a figure?
Correct.
Where did you get that figure?
Correct. And then they're like, they felt warm. So it was
Warm
a
to
fever.
touch.
Yeah, so a mild fever. I'm like, So that's what I wanted to debunk in
Okay,
this,
that's a
in this
very
particular
good one.
That's so
forum.
good.
And I'm not saying your baby's not sick. That's, I think, the
Yeah.
most important thing.
Yeah.
But let's keep fever for the right definition, kindly. 37.5 and above. And for me, my personal definition of severe fever is 39 and above. Yeah. Between 37.5 and 39, your baby is sick, but at least that is mild to moderate.
Yeah.
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 I'm so glad you've talked about that. I'm so glad.
So that means you experience it as well.
A lot.
Yeah.
All the time. All the time. And so, you don't know how to tell a mother.
Yeah.
See fever, like, just relax.
Like how to tell them, bring the thermometer, bring the definition, then
Yeah.
we give you
Yeah.
actually, yeah. But I think it's also because you do vitals separate from where you're consulting, where you're seeing the mother and the baby.
Yeah.
But sometimes imagine just bring them to you, bring them Harper and just tell them, actually, let me just go out, let me get a thermometer so that I can come and I show you. Or we can come and check. Then we see it's actually not a come I show you, because that can be a bit dismissive.
Yeah.
Come, we check. We see this is a fever. This is not a fever. Yeah.
Okay.
Mm-hmm.
Wonderful.
What about you?
I have none.
You have
but
none?
I have none, actually. But let's see. Can we talk about allergic reactions to drugs?
Yes. Yes.
Yeah.
So there's a difference between, like, I'm allergic to a drug and I've had adverse effects to a drug.
Yes.
Yes. So I feel like we need to, like, there's a very
Differentiate
yeah,
them.
there's a very subtle distinction between, like,
Add another one.
yeah,
Side effects.
side effects.
Yeah.
That's actually what I was looking for.
Yes.
Because your favorite drug.
Well,
We've talked about it before.
that drug showed me mumbles. In case you don't know what it's called Flagyl.
Or
Metronidazole.
metronidazole.
The devil.
Hey, you guys, let you prescribe.
Let me tell you, actually, after I had my personal experience with metronidazole,
Yes.
and this is not saying that it's a bad drug, it doesn't work. It does work, but I think I used to dumb down a patient's experience. Like, oh, it's not that bad. Where?
Let me tell you.
Did
my
you finish your
experience
dose? Let me ask.
Did I imagine I did.
Oh, good.
I did. I had to practice
well
what
done.
I
Actually,
preach.
well done. That one,
Yeah.
that one.
I
well
had
done.
that one I
Very good.
finished,
Yeah.
but
And can we also talk about the fact that people get flagyl all the time?
yes.
A bit of diarrhea.
Flagyl.
One week, their
For
flagyl.
pharmacy.
A bit of
Flagyl.
diarrhea.
And
A bit
when-
of vomiting.
International-
Flagyl ya kwanza.
That's a Pandora's box. Do you wanna open it?
I'm
Because
sorry, sorry.
it's deep in my heart. Antibiotics over the counter.
Yeah, I know, right?
That's
yeah, I
a
Kwanza in
get it.
pediatric care,
Pandora's
my dear, I don't know
box.
how we will help each other.
It's
Apple.
true. I feel like there are just so many places where we could have stopped it, but it starts here, it continues here, it continues. You're just like,
And it's really being propagated.
where?
Sabisa.
Yeah.
But I think let's bring it back to what Dr. Nyando was saying.
Yeah.
And what you were saying as well. How can we make this easy for somebody at home to understand what is a side effect, what is an adverse event, and what is an allergy, a true allergy?
Okay.
Because even me, if I have a side effect, I might put this drug as an allergy category because I don't want to experience that level of discomfort again. So how do we help people at home differentiate?
Okay. Let me start with what I can remember.
Yeah.
Because please remember, we don't know. We know, but we don't retain everything. So an allergy it's a hypersensitivity reaction to something. It can be a drug, a component of a drug. It can be a vaccine, to basically anything.
Pollen.
Yes.
Yeah.
So your body is literally saying, we don't like this
We don't
one,
like it.
and it will respond. So how it responds is basically
Like rashes.
like rashes,
That's the most common.
yeah, swelling,
Swelling of your lips, your
even
face,
of your throat,
these things they call wheals
and
right?
hives. Yeah.
Oh, hives. That's a good way of saying it. Random sudden swellings on the
Yeah.
whole body.
Yeah. But to be honest, we'll put the descriptions here, like the
Yes.
proper descriptions, but
okay,
we're just
okay.
explaining small.
Okay.
Side effects are common effects that are seen with medications using a cohort that has been studied. So for instance, let's say Flagyl. When they were doing the R&D for Flagyl, they noticed from their study group, this particular subset of people had nausea. This one's had diarrhea. This one's had... So it's a common effect seen when using a particular drug or even a vaccine, but not harmful.
Not harmful.
It's not...
It
Side
won't kill
effects
you.
are not harmful.
not
and
kill
it's
you.
written in the booklet.
Yes,
if
it's
you
written
if you
in
read
the-
the pamphlet,
Yes.
it will
there.
tell even percentages. It will tell you
Yes.
greater than 10%,
Yeah.
less than 10.
Yeah. And also your doctor can advise you on like how to
Correct.
counter the side effects.
Correct.
Now, adverse effects are like side effects on steroids. So they can be detrimental to your life. They won't necessarily kill you, but they can get to the point where they are fixing you almost.
So
No
maybe
hapo.
like persistent vomiting.
Yes.
Yes.
Yeah.
To the point of you're weak or something like that.
Exactly.
You need hospitalization.
Yeah.
Okay,
So
yeah.
it's on steroids.
Yeah,
Yeah.
that's
Have we
a
done
good
it
way.
justice?
I think
So,
we have.
You've done a good... I'm so glad you've done it. I'm so glad.
We've
Thank
educated the
you.
peoples.
Thank you. So now let me tell you.
Tell us.
How you felt when you took Flagyl.
Way.
Sasa pewa IV.
Oof.
Pewa IV.
Oof.
And then come we discuss.
I'm not coming to discuss because I've not been given IV. As of now,
Oh,
I'm
can I
not.
also say something very
Yeah.
interesting? Depending on your inpatient experience, I think let me talk about mine with tramadol. I think mine was tramadol. Tramadol is another pain-like medicine that's normally given. I think I got mine after I gave birth to the babies. It gives you nausea. So that's a
Yes.
side effect.
Yeah.
And I think it actually might be an adverse effect-ish because my doctor then added an anti-nausea medicine
Medication.
to my medicine list. And so sometimes doctors are kind enough to know this thing is not going to take you well.
Yes.
Let me add now another
Something to
drug.
counter.
Plus, let's not also
Yeah.
forget the stool softener that you also need for tramadol.
Yes.
So it's actually like one drug that will help you so much. It needs two other drugs for you to benefit. It's medicine is actually very complex. Huh?
Yeah.
It is. And that's why
Very
people
complex.
need
It
to understand it
Yeah.
so that you can know how to navigate these situations.
Correct.
Yeah. Hey, I've seen that we've digressed. Anyway.
Oh, yes.
Why are you here today? Do you want to explain why you're here?
Tell us. Tell us.
So basically, we've been having this series of motherhood. So it's called A Journey to Motherhood. Hopefully, maybe I hope that's the title I've used. And it's just from the beginning, from deciding you want to have a baby, conception, pregnancy, labor and delivery, postpartum, iendelee hivyo. So how does it play out for women? I know everyone's experience is different, but there's some common similarities that we may have and share. And it's just to help moms out there. You're not alone. And this is just how you can deal with some of these things that happen during these various seasons of your life, of your motherhood journey. So we had Lynn come and talk about her experience, also known as Mind Fenced. So she was just giving us her motherhood experience. Then we had Dr. Maureen and Dr. Vundi. So they came in to talk about from now you've given birth to postpartum and just how that plays out and what are some of the things that we can do as the medical professionals to help you in that journey. So, of course, Dr. Vundi is a mental health advocate. She's a psychiatrist. Dr. Maureen is a gynecologist. Mothers, because she's a gynecologist, because mothers, you forget yourselves. And remember, you also
Yeah.
need to heal because you've gone
Yeah.
through labor and delivery. So that's why Dr. Maureen was
Can
there.
we just say that she was my gynae? She
Yes.
is my gynae, and she's the most amazing gynae.
She's so funny.
She's
so
I
funny.
just love her for free.
Yeah,
she's
she's
so
really,
good.
she's a vibe.
She's
That's
a
the word.
vibe.
She's a vibe.
She's a,
And now
she's
imagine
good with
that
her work.
as a doctor.
Yeah.
As in that is your doctor.
Yeah.
That's amazing.
Yeah. So we've thoroughly enjoyed those conversations.
Alright, good.
And now you guys are here because you are, as you mentioned, child health advocates in your various areas, breastfeeding and just child health in general. And we just want to talk about, let me call it the first 1,000 days of life. There are many, those are many, but just what are some of the things that mothers can look out for, can do to ease their journey even as they're stepping into motherhood, and also just breastfeeding, how to navigate this space. And we will never stop talking about breastfeeding.
We can't.
No.
Yeah, we will
can't.
never.
And
So
it is
if you watch Dr.
Breastfeeding week this week.
Yeah.
It's Ishad, but yeah.
Oh,
Yeah.
well,
Is it?
but we
Yes.
celebrated
It's
it.
1st to 7th.
Oh gosh.
Yeah.
Oh, really?
Yeah, but we'll
It's
still
not Friday.
Oh,
it's
so, yeah,
7th.
I
Yeah,
think
1st to 7th.
She means
you're
like the first 7 days.
Yeah, you're right.
No, it's 1st of August to 7th of August.
Yeah, you're right.
So, but no, it's okay. We can still involve it.
Sorry.
Yeah, but I was telling them,
Sorry.
if you watch Dr. Ngendo and we talked about breastfeeding, we are talking about it again.
We can never stop talking
Yes.
about
Yeah,
it.
Yeah. So first of all, why you're here as well is because you're mothers. And I think it's very crucial to have people who have gone through these experiences. Because as I keep saying, I can only give you what the textbook tells me. But when you're there,
Qua ground.
Vitu is different. So first of all, how was your journey to motherhood? Especially when the baby has really come. I know pregnancy is different, but the baby has arrived. Yeah.
Oh my goodness. With my first baby, I got serious blues.
Ooh.
Serious blues. Yani ile unaketi and you're just crying inconsolably, uncontrollably, for no apparent reason. And that's the key defining factor of postpartum blues, is that there's no identifiable cause of it. It's your hormones are all over the place. It's you're anxious, you're sleep deprived. There's so many changes going on. So I got blues, but thankfully I had a really good support system. And I feel like that's the key for me when I'm talking about motherhood and especially breastfeeding, is support.
Okay.
Yeah, what does support look like? Support looks like different things for different people. But I can for sure say that I had really good support, especially in the first 3 months. And for me, breastfeeding, my firstborn was...
You just get light up when you're talking about it.
I know. But for my firstborn, it was the ghetto.
Yeah.
It was the absolute ghetto. But when I had my secondborn, things just turned around.
You're like, this is my time to shine.
God, by the way.
Ni
God. I had such a beautiful, beautiful breastfeeding experience the second time round.
Yeah.
And the key thing is support, honestly. Support. Yeah. What was it like for you?
In terms of the breastfeeding side.
No. Let's
Or
start
just
from like now.
motherhood?
Here's your baby.
All right. Mine was my 2 babies, unfortunately. Both got sick soon after birth. The first one had what they call neonatal jaundice, so he was very yellow. We were being discharged. I was excited. And the doctor said, let me come and write the discharge. I'm like, is that baby yellow? Let's just check. It's like, Mom, wait, CG 90 minutes for the blood test. I was already packing my things. We're going. Then I'm being told, no, your baby's blood level. And then the problem is doctor to doctor. And my husband is also a medic, so we're 3 of us. So they came and they were like, your baby's jaundice level is above normal, but you could do sun at home. But we also did a septic screen, which is a hemogram and a CRP, for those who want the technicalities. And I'm not happy with where the CRP is. This is my limit. So my husband just looked at me and he's like, what do we do? Do you want to risk it with your first baby? What if we go home and something happens? He's like, at least we're here. And we agreed. We all discussed and agreed. We said, okay. So that meant my baby, the firstborn, had the blue light and he also got IV antibiotics. Again, that's a very interesting story about my children with antibiotics and how it affected them later, especially with colic. But we'll talk about that later.
Okay.
So then we said, I think another 2 or 3 days. Then you go see, for those who don't know, when your baby has jaundice and they are blue light, they have to be butt naked.
Yes.
And then now they have
Their
a small
eyes.
little mask over their eyes. It's warm though,
Yeah.
but they are butt naked. So, you know,
Yeah.
you go see your baby looking all
Yeah.
funny, like a small
helpless.
alien with like a thing over their eyes.
Yeah.
And he was put in HDU at that time because that was the best place for him.
Okay.
So that was a small trauma. I thought that was the most traumatic. Then I had my second born, and I discussed that, unfortunately, he pooped in the waters when I was still pregnant.
Okay.
So as I went through labor, when my waters broke, they noticed the waters were not clear, the waters were brown. So that meant it was an emergency CS. When the baby was born, he wasn't breathing well. So he had inhaled some of the meconium waters. So now his was so bad. And then, you guys, I'm lying on the CS table. My baby has been weighed, blah, blah, blah. You can hear your baby's crying. Then the pediatrician brought the baby to me and opened the chest of the child because the baby is bundled and was like, Doc, you look for yourself.
Yeah.
Yo,
You can see
the ribs were like... And by then, it's like she's
Unakubali
telling you,
tu.
but asking you
Yeah,
at the same
yeah.
time. Like, as if trying to tell you, I'm not being extra.
Yeah.
But also, it was slightly traumatic because this is now almost the
Exactly.
first time I'm meeting my child.
Yeah.
Then you're just unbundling. So now he ended up in the NICU, the neonatal ICU. He was there for 5 days and he was on CPAP. So now his nose, he had tubes everywhere. He had ECG things. I met this baby. So it's like a baby in ICU. And you couldn't touch him anywhere. The only thing I could touch was his feet. And for me, the most traumatic thing for me about him being in the NICU was the fact that when I was pregnant, I could feel the weight of my child. And with my firstborn, I could feel the baby on me. But this one was born and I couldn't feel his weight anymore. Like the feeling of the baby was not, I couldn't hold him. He wasn't in my tummy. And I could only hold his leg. So my mind was like, you can't feel your baby. I don't know how to explain it. Hey, where?
That's rough.
So those are my first few days for both my babies. So now I'm hoping if I go again, I'm just praying and hoping it will be smooth sailing in,
Yeah,
out,
God.
in, out.
Thank God.
Let me tell you, the one thing about mothers, honestly, how you guys go back, I don't understand.
I know.
Even us, we
I
don't
don't
understand.
understand.
Even us, we don't understand.
Unajikuta tu lakini.
I think I told myself it's only 3 months. Out of your long life and your baby's long life, it's only 3 months. Yani vumilia to do what you have to do, because by the time they turn 3 months, I feel like they're so much stronger.
Yeah.
Things are better.
Yeah. I love that you've talked about like now the neonate and that you love neonatology.
Right.
Now, when the baby is born, there's something we do called an Apgar score.
Right.
And we need to check for, it's a scoring system. So there are various factors that we check to see this baby is okay to go to the nursery, this baby needs to go to ICU, needs to go to HDU, and needs resuscitation.
Right.
Do you mind taking us through the parameters of the Apgar score?
Sure, let me do my
tell us.
best.
Pediatrician.
It's been a minute.
Yeah.
So the first one is tone, how your baby looks. Most babies are supposed to be curled up. One is heart rate, one is respiratory rate, another one is color, and the last one is...
The cry.
I think
the cry. Yes.
The cry.
Yeah.
So those are 5. And the Apgar score goes from 0 to 2. And if they have 5 parameters, the maximum is 10 out of 10. So if your baby is 7 and above, they're okay to go to the ward. If they're between 4 and 7, they need monitoring. If they're below 4, most of the time you're resuscitating. But this is a medical thing. And when you go home, the Apgar score is written on the discharge summary. It's measured at minute 0, minute 5, and minute 10. Because we expect babies when they're born, sometimes they don't cry. But by 5 minutes, we expect they're crying. Now their arms are like close to them. The heart rate has peaked. So basically, as much as it's the first 10 minutes is very critical, we still give your child a chance to come on, wake up well.
Like fight kidogo, you know?
We've been in a different setting. Now it's this setting. Come on. So we tend to give them time. The ones that are very unfortunate are that there's no movement, there's nothing. The baby's not crying, there's no heart rate. A bad tone is floppy. Floppy means
like the baby,
like hair too down. So those are, if we see 0, 0, 0, that's also very concerning.
Why I asked that is because it was very nice that the doctor came and showed you that you doc, even you just look. And as a doctor, you have that knowledge. You know what you're looking at. But you know, sometimes as a mother who's not a medic, you don't understand why your baby's been taken away. So that's the scoring tool that we use to assess the neonate and to determine what level of care they need at this particular moment.
Yeah. And also to note, and it's really unfortunate, but sometimes it happens. Sometimes you give birth and your baby is resuscitated right there.
Yes.
You can't even transfer the baby. You see, my son, I met him in the NICU, so he was able to stabilize until he reached. But sometimes a baby is born and you need to give oxygen there. You need to do CPR there. So circumstances are different.
Yeah.
But yeah, I think if possible, I don't know if this happened to you. Can your gynae bring a pediatrician to say hi to you before your baby is born? Just to say, hi, mom, I'm the one to take your baby.
Yeah, that's
Because half
very
the time,
important.
you don't even know who's receiving your baby, and they have partnership with each other. So the pediatrician has already been called by the gynae, like, hey, tuko na moja ako 8 centimeters. Usikwe mbali.
Moja, not even, you're not a person, you're a moja.
Gosh.
And then they tell you where they are, so you can jipanga your time. Usiende mbali juu, uko karibu.
Yeah,
That's a
that's
nice
so
thing.
important.
I
I
wish
have
they did that.
cousin who unfortunately did not meet her pediatrician, didn't even know her pediatrician. So now it's when I went to see her, is when I asked her, oh, who's receiving your baby, by the way? And she tells me so and so. I'm like, oh, okay, I don't know her. But she ended up having a really bad experience with her.
Oh, no.
Unfortunately.
Yeah.
So I think also it's good to give moms a chance to choose for themselves.
Yeah,
the
or just
pediatrician
even
they
say
want.
hi.
Yeah.
You don't even know we're laboring and we're in pain and it's extremely uncomfortable. If the doctor who is going to take this baby from me comes and says, hi, mom, I'm the one. My name is so-and-so. I work here.
It gives you confidence in them.
I'll be there.
Yeah.
That's just all you need. Mine was introduced to me as I was being told, Boosh! He's like, Niko hapa by the way. Hapo kwa kona. Yeah, my legs are here.
Like, I'm just waiting for you.
Yeah, I was like, I'm the one.
But yeah, that's actually very important.
Yeah.
Wow. Hey, I don't know how I would receive that. Like, even you just look for yourself. I feel like I keep telling people, me, if I'm to have a baby, you guys, hysteria.
But you know what? You'll have a lot of support. I think what was very difficult about our experience was it was the last thing we were expecting. You know, you've carried this baby well. You're not expecting that the kid has pooped.
Yeah.
So you're not expecting your kid will be sick. So even when we were being told this has to be a CS because your child is critical, like something has happened inside, we were so confused. And you know, emergency CS, you have to be on the table in less than 30 minutes. So they're like, Mom, change, sign consent, let's go. We need to go. And I'm just like, wait. I'm already like 6 centimeters. I'm almost 7. Like the end is so near. You mean I've labored all these hours? Nimefika 6 alafu unaniambia, you know. And then, you know, so you're just, I don't know. It was just one of those things that it was coming too much.
It's interesting. We think about so many things when we are pregnant, including mode of delivery.
Yeah.
But like at the back of your mind, you know that CS is a possibility.
Yes.
But it's at the back.
Yeah.
Like you're never like, okay, let me prepare for like potentially having a CS.
Actually, interesting because there's some
people
Dr.
who
Wundi actually
choose.
mentioned she wanted
Yes.
a CS. So it's true. For even for me, if I was to think about it, I feel like I would want to. However much I don't like pushing, however much I can't even fathom the idea of pushing, but I think of CS and I'm just like, guy, major surgery. It terrifies me.
Yeah.
So it's true.
But some people actually choose to go ahead with it.
Yeah.
I also almost had a CS. You
Hey,
know that?
you remember? She was on the
I was
table.
supposed to have a
Really?
CS because my baby was breech.
Oh, okay.
Yeah, breech means was not head fast.
Yeah.
So he was coming with his bum. And I'm like, okay, fine. So it's a CS, right?
Yeah.
Okay, bring the consent forms. Let's say I'm in labor. Go. The pain is at its maximum. And I'm just like, you know what? Whichever is faster.
Yeah.
Hey,
Yeah. At this
let's
point.
just get over and done with it.
Yeah.
And so when my doctor, Dr. Maureen, she really encouraged me.
Yeah.
She was like, this is your second baby. You are almost fully dilated, basically, at this point. Let's give it a shot. I mean, see, I'm here.
Yeah.
We are here.
So you did it in theater?
We did it, no, like right next to theater, in the delivery room, which is right next to theater. So everything was ready.
Just
My
in
blood
case.
samples had been taken. I had signed consent. So just in case we needed to rush. Anesthetist was there, pediatrician, everyone was there. But my gynae was like, let's give it a shot.
done,
You're fully dilated. Let's go.
Please clap for yourself.
Hey.
Clap for yourself. That's not
Lakini
a joke.
kupush breech.
Clap for yourself.
Hey.
Me, I told her, by the way, the first lady I saw delivering a baby who was in breech position was in Kenyatta. It was a Saturday. As we were there, just students. Where? Hey, yeah.
Trauma?
Me, I said, by the way, kama si a
Yeah.
must. But then also, not even that, as long as you have a skilled professional.
Yes, correct.
Because the
Yes.
doctor who was there was so confident
Yeah,
and so skilled.
about
They
confidence.
did such a great
Yeah.
job. And also how they were reassuring the mom. Oh my God. You know, you're just here thinking, it's Kenyatta. It's you next. But that doctor really reassured the mother. I was just like, Aki, you've done such a good job. Like, where?
I love it.
But I was traumatized. I can't lie.
It's traumatizing.
I was traumatized.
Yeah, it's
Yeah.
traumatizing.
I've just thought about something and I was just like, should we spin this episode? I'm thinking we should spin it.
Go ahead.
Because let's talk about how to navigate complications
Of delivery.
because it was not your
it
expectation.
was not at all.
Yeah, even for you, because your child ended up in NICU, it was not what you expected.
At all.
No.
At all.
Okay, let's talk about that. And
Let's
then we'll talk about
it.
peds another time.
Yeah.
Yeah.
Absolutely.
Yeah, exactly.
Absolutely.
Because I think many a times and I was telling Dr. Maureen this, that many mothers enter motherhood traumatized or with not what they had expected. And it's not because you had like the baby has come out and it's not what you expected. Even just that labor experience can be so traumatizing. But now that a complication has happened, how did you feel at the hospital? Did you feel that you were managed well? Did you feel that your voice was heard? Did you feel that the care you received and the care your baby received was what you expected as a doctor?
You want to go?
Let me go.
Okay.
I'll talk about my second born because he
Okay.
was the one who was most sick, right?
Yeah.
So the first time I saw him, like I said, he was in this not an incubator per se, but he was in the resuscitator. It's like a bed that's up high which has a heater on the top. So they're just wearing diapers with nothing but all of this medical equipment all over them.
Yeah.
And at that time you become a mother.
Yeah.
You're not a medic. So initially I was extremely traumatized because, like I said, I couldn't hold my baby the way that I wanted to.
Yeah.
And also I couldn't feed him because he had a tube which was an NG through the nose to feed him. Isn't it? They were literally, this boy looked like there were tubes everywhere.
Yeah.
And that was the last thing. And that's the first time you're meeting him officially, apart from that thing at the theater, right? So my emotions were all over the place. The first thing is fear. Like what could happen to my child? Like what has happened and what could happen? My husband was really supportive and he was the one who had a lot of the doctor conversations, especially the first 24 hours, because they advised me to rest after the CS. They also gave me something that knocked me out. So I was sleeping a lot of the time. And because he was on CPAP is, it was going through his nose to keep his lungs clear from all of that meconium that he swallowed. The CPAP, I think, started at 50. And he's supposed to go down to 0. So now we were counting. There becomes this anxiousness of which number are we on now?
Yeah.
And people are calling. Because you've told people, I'm laboring. And then remember, like what Doc has said, for me, CS was, it was a possibility, but not as an emergency. And not at out of nowhere. And not after more than halfway of this other very painful journey. You're now telling me we have to go this way. You know, it was like an about turn, completely out of the blue. So people asking, what number are we on CPAP? Where have we reached now? So there's anxiety from so many different people. But my experience was actually made better by another mom. She was having her second baby. And her baby was born at 34 weeks. And she went into early labor due to severe shock. Something happened with her firstborn, like a near life and death situation. And she was somewhere around. And when she went, her whole body went into that shock that you go into. And then she went into labor. So my baby was huge, 4 kgs, huge. Big looking fat thing.
What was the term? What was the term for a 4 kg? For
macrosomia.
Macrosomia.
Yeah. So this baby was 4 kgs. I was eating ice cream and Indomie like a crazy person those last few weeks.
Lynn is sitting here looking at you. Me, I couldn't even eat because she said she had gestational diabetes. So she's looking at people. She's just like,
oh yeah.
And you know, because my babies, the first one had issues with colic, I couldn't take a lot of dairy. So I was taking the dairy now before the baby was born. Anyway, so he was a fat baby, right?
Yeah.
Hers was like 1.8 and they shared next to. So we are there trying to look for milk, trying to hold our baby's legs, and we delivered on the same day. And so I was just like, what's your story? What happened to you? And she's like, this is my story. And it's quiet. There are beeps all around. Even the environment, it's literally an ICU, but now for babies. And then there was another baby on the corner whose the diaper, the smallest diaper, was reaching their nipple because the baby is so small that the diaper can't fit them appropriately.
Yeah.
So you have all this trauma like, okay, can we just get out of here? And only the mom and dad of the child are allowed in. So the grandparents and our support system could not come. So now we're sending pictures, and the reaction coming from outside was also really difficult. But our doctor tried, and she did a really good job. I only had 1 or 2 really weird complaints. And I think as medics, you'll know one.
Okay.
So she did all of these blood tests, and one of them was like, oh, I wanted to check whether your baby has jaundice. And I was like, so what's the baby's blood group? And she's like, let me check. Oh, we didn't do that test. I was like,
So what were you
that is the
taking?
ABC
Yes, of jaundice.
of jaundice. It's not even
Are you?
XYZ. That is first
Are you?
line. You've done 17 tests on my baby. Let's
But
not talk
not
about
blood
the cost,
group.
but not blood group.
Come on.
I just gave her side eye. I was like,
Side
I looked at my husband. I was like, this is the one looking after our baby.
It was an oversight. Let's just.
Yeah.
That's I think what I said. Because I was like,
oversight.
I looked at my husband. I was like, this is the one who's taking care of this one. What's the baby's blood group? Because my husband and I had different blood groups, and for those who don't know, that can sometimes cause jaundice issues in babies, right? So I was like, where? I think after that she was like, okay. Then the second very weird thing that happened. So the rest of the care they did well. The tubes started coming out. They told me I can feed the baby small milk. So now I had this pressure. After CS, your milk doesn't come out so much, and then I have this pressure of trying to keep my baby full. So I'm drinking, I'm taking marmalade, I'm pumping, I'm expressing, I'm like, milk has to come. I asked the hospital, and they were so kind to give me a thermos of bone soup every day. So I was finishing the thermos, hot chocolate, what?
Wait.
Then I'm going and I'm giving my milk, like I brought milk. So one day I went at 2 a.m. and I found a nurse there who had started dozing off, and her too, she was pregnant. So I didn't want to disturb her too much. I was like, here's the milk, I just bought it for this baby. Show me something like, now you, what's your problem? You're just bringing milk at any times of the night. Can you just do it at reasonable hours? I bring this thing in the morning. Why have you come to disturb me now? I'm like, yo, I'm on orders to get 30 ml per kg. This guy is 4 kgs. That means I need to figure out how to get like 60 to 90. Oh my goodness. So the only reason I looked at her and kept quiet, number 1, she was a night nurse. And number 2, she was very expectant.
Yeah.
And number 3, I was like, before I left, I was like, but has he fed? She told me, yes, I've just fed him. I said, okay. And before I left, I'm like, better that baby's crying. You better go and sort them. You're not here to sleep.
Yeah.
Yeah.
As a mom, that's the last thing you want to hear.
Can you imagine?
Oh no.
Ati usilete maziwa
Oh
sahi.
no.
Hii ni saa ngapi
Oh
unaleta
no.
maziwa?
Nani ICU.
Nani
Imagine.
ICU? And I'm under strict orders because we're trying to prevent formula because the baby is too newborn, right? We're trying to prevent formula as much as possible. Let mommy try to look for milk. And the way I'm laboring to look for milk on that side. So that was also really weird. And then the last very interesting weird thing that happened was the doctor came to me and told me, I'm worried about your baby's heart. I feel like your baby's heart does not fluctuate. They don't go from, let's say, 110 to 160. And that's normal for babies that age, right? Your baby stays around 130 all the time. Even when he's crying, it doesn't fluctuate. So she took me, and remember this is ICU, so they have those machines. She took me, she's like, look at your baby. And sure enough, 120, 130, just there. And she pinches him again, doesn't move. The next baby, remember the mom was encouraging me? That one was going to 180 something, 130 something. There was volatility. So she's like, I think there could be something wrong with your baby's heart because there's not enough volatility. I'm like, is this what you tell mothers? You guys, this is what you tell mothers. Now, in my heart, I had so much peace because when he was in my tummy, they do the heartbeat checks. So I knew that this kid's heartbeat goes to 160. And it can come down. So I'm like, maybe I just have a chill child.
It's just like,
He's
maybe
gone through so much trauma. He's like, it's my time to just relax now. Give me a minute.
I've been stressed.
Give me a minute.
And guys, that's his personality till now. As long as you give him and he's settled, hata kusumba, ako too very relaxed.
Wow.
So we had to do, I think, an echo. We had to call the cardiologist. I should not tell you how much the cardiologist cost. Just know it was like, plus echo. Only to be told, mommy. And then when I went to see the cardio, she's like, your mama said so. Yeah, your baby's okay. No problems. All clear. As in small things.
Yeah.
But let me also say, I don't think any hospital stay is going to be perfect. And the things that happened were not critical bad enough that my kid did not improve.
Yeah.
The reason that took him there, he was getting better. But these small things on your psychologicalness or the way people either gaslight you for bringing milk for your own child, or the way they can raise problems out of nowhere. You start asking yourself, is this me and you have an agreement thing that you get mothers to be scared? Like, I just, there's some things that I had to put question marks on, but not bad enough for me to be like, my kid has been directly affected. Yeah, so that I think was
Did you have the same pediatrician for your first baby and your second?
No.
You changed?
I did.
Okay.
I did.
Okay.
I changed. Yeah.
All right.
By choice, by circumstance.
I think because he went to NICU, I don't think the first one was as NICU sensitive as the second one.
Yeah.
Yeah.
Okay.
Yeah.
Okay.
Right.
Now yours is a different experience because that's now the complication after the child has come. Now yours was labor.
Mine was labor.
Yes, so-
and it was both.
Both babies?
It was both.
Well, yeah, what happened?
Do you remember my first
You know, sometimes
delivery experience?
you block things out because even for me it was a traumatic experience. But yes, I do remember. Yeah. So because you've entered, you've come to hospital with a certain expectation, but now you're being told, no, this is not what we are saying. How was that for you? And also, how did you feel it was managed? Yeah.
So my first labor and delivery was absolutely horrible.
Yeah.
Terrible. Worst experience of my life.
Wouldn't recommend.
Would not recommend. Would not recommend the doctor. Would not recommend the hospital.
So you were not with Dr. Maureen at that time?
No, I was not. I was not. So, so I went for an induction. It was a scheduled induction because I was on medication. I needed to have a scheduled induction.
Yeah.
Right. I'm ready. I'm prepared. With my husband, we go. We get settled. Call my doctor. Tumefika. Are you coming? You know. He's like, I'll come in the morning.
Yeah.
Let the nurse start the induction. So the nurse started the induction. I was not too happy about that because I've been with you throughout this whole journey. If she starts the induction and I deliver in 1 hour, are you going to be here? Okay. So I was not happy about that, number one. Anyway, it didn't work. So he came in the morning, 8 o'clock, redid the induction.
Let me just ask a medical question. Were those 6 hours apart, really?
Yeah, because
you got there like midnight-ish.
2 a.m.-ish.
Oh, okay.
Yeah.
Okay.
Now,
good.
because you've asked that question, maybe let's explain how induction works.
Yeah.
We kind of.
We're not gyners, but then, some people think that, okay, fine. And I think we talked about it like in the previous episode, but just kidogo.
Yes.
They think that the first
induction works.
induction dose
Must
is the
work.
only one and it
Yes.
must work.
Yeah.
okay.
But it can go for 48 hours because there are 2
Yes.
cycles,
Yeah.
each of 4 doses.
Also, there's a difference between induction and augmentation.
Exactly.
Yeah. So
Dr.
the
Maureen broke
drip,
it
she
down.
did.
Yes, she did a stellar
Then
job.
we're not going
Course
to go
she
there.
did.
Stellar
Of
challenge.
course.
It's just
did.
the number of doses that we had to.
Yeah.
You can actually go 2 cycles, each 4 doses.
Yeah.
And that, of course, there has to be spacing in
Yeah.
between.
Yeah. Normally 6 hours.
6 hours. Yeah.
Yeah. Can I just big up myself? That
Yes,
when I
you
was,
can.
When I was an MO in Mashinani,
Yes.
my first Nini always used to work.
Your first induction?
My first induction
Girl,
always
used to do in the
mine
cervix
never.
or what?
I used to just sweep it and gently and then encourage the moms. None of my patients ever like screamed or complained about pain during
you're doing a
VE or an induction.
Yeah.
None.
Even
Why
me,
didn't
because
you go to
zero.
Obstein? Clearly you have a
It's not
college.
too late, but it's not too late. Lakini no.
I'll say even
No.
for me a VE because my fingers are very thin but long. So they never used to complain. They're just like, let's get to...
watu wengine. Anyway,
Yeah.
so he comes in the morning, 8-ish, does the second induction. And as soon as he leaves the door,
Yeah.
I was like, this is happening.
Oh.
So it just escalated so fast. Like I went from 0 to 100
Wow.
Yeah.
really quickly.
Yeah.
And so I now start to complain of pain. This is now maybe an hour later. I'm like, this pain is too much. It's too much. Like, can you do something? And I feel like when you're in labor, I think you also know, like, you're not yourself.
Yeah.
You literally hysteria.
Yeah. I was got me, don't please.
You're
It's
not
for real.
yourself.
Yeah.
So literally, I'm not thinking straight.
Yeah.
So all I can do is like express my discomfort and be like, can you do something? Do something. And they were just like, no. Surely 1 hour, of course. You're a primee. Primee's first time mom.
yeah.
We also need to debunk that. What is the word? When they put something on you, a label on you that's not true.
Yeah.
Assumptions.
Yeah.
Please don't assume all these
Anything
primary
can
things.
happen.
Yeah.
Yes,
Expedited
just
labor.
mind.
That's
Stop
true.
assuming.
So there, wanapuza. Like, okay, breathe, do all that. At this point now, my mom has come.
Okay.
And now I'm just like, mommy, this is too much. Like, I can't handle it. What's happening? So instead of checking how far now I am dilated, they decide to just give me painkillers.
Oh, painkillers.
So they give me pethidine. Pethidine is an opioid, for those who may or may not know.
Yeah.
And I just now went into another world. Like, you're already hysterical because labor. Sasa umepewa pethidine.
Which makes you like a little bit high.
It makes you very high.
You lose touch
Yeah.
with reality.
So
Let's
I
just put it
actually
like
blacked out.
Yeah.
that.
I literally blacked out for a good hour. I cannot tell you what happened. It took the pain away, yes, but mostly because I was blacked out.
Yeah.
And it also makes you sleepy, yeah?
Yes.
And
Yes.
drowsy.
Yes.
Very drowsy.
Extremely.
My question would be, I'm not a specialist in this area, in this field, but how are you supposed to push?
That's a very good question.
Okay. Next. Okay.
So I wake up now from these days and I'm just like, I was supposed to get an epidural.
Oh, okay.
Why have I not gotten an epidural, guys? So I call my doctor. He doesn't answer.
Hey.
I call him again. He doesn't answer.
Hey.
I tell the nurses, please call my doctor. I'm supposed to get an epidural. I can't handle this pain anymore, guys. Like, I'm going mad. Please give me an epidural. They dilly-dally, they laze around. And then my mom calls the doctor. He still doesn't answer. A few minutes later, the nurse comes and she's like, oh, okay, we got your doctor. Let's go for the epidural. We are going to theater for the epidural. Theater in this particular hospital was about 4 floors down. So, for example, I'm on 6th floor. Theater is in 2nd floor. Now, you want this pregnant lady who is so uncomfortable, in so much pain, to go all the way to 2nd floor.
I hope they were taking you in a wheelchair.
So, yes.
Yeah.
Oh, God.
Right before the nurse came to tell me, let's go, a different nurse came to check how far dilated I was.
Which is, by the way, a requirement for epidural.
Yeah,
we
it
should
is.
put that as an asterisk. It is. They
Yes.
cannot give you epidural if you're too far gone.
More than
Yeah.
6 centimeters
Yeah.
really doesn't make sense anyway. So she checks and tells me, you've not really progressed. You're like 4 centimeters. I'm like, no, I can't be. Like, this is how I die. Because sasa
Anapanga
munakata
kunimaliza.
kunipe epidural.
Yeah.
And then you expect me to stay in this state
yeah.
up to 10 centimeters. Nah, you guys are joking.
Yeah.
You're actually joking. I told God, if this is how you want me to go, just take me. Just take me. I'm ready. As long as I'm coming to you, I'm ready. I'm ready.
Where?
So yeah, she tells me 4 centimeters. She comes, now the other nurse, I sign consent, get on the wheelchair, going down. I cannot tell you how I got there. And as soon as I get into theater, the first thing I hear is one of the nurses saying, Ati, ay, iyo kelele yote nako 4 centimeters.
You see these nurses' comments. Anyway.
Where?
Yeah.
Yeah, that's not a
It's
nice
so
thing to say.
demoralizing.
Oh my gosh, I was so heartbroken.
Yeah.
If I had the energy, I would slap
Yeah.
you.
Ni venye mumenipatia.
If I had the energy.
Yeah, that's not
So,
a nice comment.
But in my head, I'm like, for sure, I'm not 4 centimeters.
Yeah.
You guys, this pain is insane.
Yeah.
That's
Like,
the
I've
other thing.
never labored before, but this pain is insane.
Yeah.
I can't be 4
I
centimeters.
mean, like, I might do the V for myself just to confirm.
By the way.
And then I should put out here for all the medics or moms who have delivered, just before I left, I pooped. There we go.
Prisha.
Yeah.
So I get to theater and I'm being told, get on the theater bed. You're supposed to be like this in this position.
Talk
I'm
about the
in pain.
position.
I'm in- how?
Yo.
How is it
Even
humanly
even being in
possible?
that wheelchair is painful.
How?
Because it's actually constricting.
And then you're supposed to hold the pillow, and then they tell
And
you
then
to
you bend.
you to curl your back.
How are you
and then they tell you
bending?
don't move.
And you have a baby. How are
And
you
then,
bending?
Then the contraction
Guys,
makes you want to.
You know the funny
contraction
thing.
makes you want
You know
to.
the funny thing. We were telling our patients that.
Us, we used to be there.
Yeah, we're like, mommy just, mommy just. Yeah, yeah.
So I get on the bed. And I'm just like, no, you guys check me. Like, I'm not 4 centimeters. Like, just check me. They're refusing. I get onto the bed. Less than a minute later, my water breaks.
Hey.
Guess what one of the nurses says? Amejikojolea, leta kitambaa.
I thought these are maternity.
Why is this story sounding new to me again?
I know.
Right?
Nurses.
Yeah.
Labor and delivery.
These are theater nurses.
Oh, okay. So
But
we'll give them a
give them
small
a bit of grace.
small grace.
bit.
Just a bit.
Tiny bit. But still no. Like you're pregnant
Yeah.
and there's fluid. And the first thing that you think about is urine. Ah, come on.
Hey.
So my water breaks and he says that. And then the anesthesiologist goes ahead to inject me with the epidural before checking. And all this time, I'm just begging them. I'm like, just check me. Like, please, just check me. Like, this pain is beyond. As soon as he knees, he's like, okay, so can you feel that? Blah, blah, blah. By the way, I lied. I was like, yeah, I can feel it. I felt nothing. The epidural didn't work.
Oh.
It didn't work.
You mean
but
once
I
he was
lied to
done?
him.
You mean
so
once
we
he was
can
done?
move
Yes,
on.
I lied to him so we can move
to the
on.
next, yeah.
Oh,
yeah.
man.
So he tells me, okay, lie on your back now, we check you.
Oh.
Next thing I know, hey, let her trolley, let her delivery pack, let her mtoto ndio huyu.
I didn't know this was a story. What?
And 2 pushes later, my baby
It's
was
how
out.
you've laughed.
Wow.
What? Baby's out.
Yeah.
But even before the pushes, the doctor who came, now obviously because my doctor, remember he was not answering.
Jesus, he's still
Yeah,
not
he's
there.
still at my
He's
head.
still not there.
He's still at my
I
head.
hope he didn't charge you his fee. Oh, good.
You would think.
Okay, me, I'm just laughing.
So
you do not
the doctor now came, and before he tells me to push, he says, we need to do an episiotomy. I'm like, no, my baby's
It's already
small.
here,
I was
yeah.
like, no, my baby was 2.9 kgs at the last scan. Nimdogo, like, don't cut me.
Yeah.
Like, I'd rather tear.
Hey.
I would rather tear.
Okay.
He tells me, no, I'm doing it, and he does it.
Oof. So basically, your voice was not heard
At all.
in any stage.
Even
when you're calling your own doctor, who you're going to pay, he's also not.
Imagine.
I'm so sorry.
But was there a reason for the no?
Who, the doctor?
Yeah. Did he give a reason why he said no?
No, see, but he's a doctor. But he's a doctor.
Ah, yeah. That's why we're informing,
Yeah.
so that you can make an
And
informed
then
decision.
at the time, I was really into not laboring on my back.
Yeah.
Oh, yeah.
You wanted to be on fours?
I wanted to be on my fours
Okay.
because that is actually the most ideal delivery position. So I said, can I stand, or can I be on my fours, or can I lie on my side? They refused.
Hey.
Not surprising there. Anyway, so my baby was born after 2 pushes.
In
It really
theatre.
did not struggle. On the
On the
theater
table.
epidural didn't work because even that cut for the episiotomy, I felt everything.
Just
Even when he was stitching, I felt everything. It was horrible.
You're a
And then
strong
after
woman.
that, you get the shivers.
You're
The
a
postpartum
strong
shivers.
woman.
Do you know they kept me in recovery for 2 hours? I was just like this.
Was your baby with you?
No. Now my baby has been taken. Ameenda na babake, has gone to the nursery. Luckily now the pediatrician took over.
Yeah.
And your mom, was she with you?
My
Was
mom
anyone
was
with you?
my mom was left uko juu. My mom was left uko
Oh
juu. So for 2 hours, I'm just alone
Oh my.
in recovery. No doctor in sight. The nurses have. And then after my baby was born, the anesthesiologist is looking at my file like this. And then he's like, madam, what do you do?
Why are you making that face?
So
I
he
didn't
tell you-
answer him.
okay.
And then he's like, I can see here that you're a doctor. And then he looks at everyone and says, this doctor doesn't even know when she's delivering.
Wait.
Yeah, guys, it was horrible. Wow. Yeah, like literally, I should have sued the hospital. I should have.
You are such a strong woman.
But at the time, my husband was just like, it's not worth it. Let it go. Let it go.
So basically, it was a horrible experience. So your voice was not heard in.
From beginning to end. And then the icing on the cake is when I later went back to my doctor at the 6-week check.
The same one.
The same one. I went to break up with him.
Oh, you want to break up?
I actually went to break up with him.
You see how we're different? You see, I keep asking questions because I'm wondering. You see how we're different? Wow. Anyway, okay. Finish.
So I went intentionally to break up with him.
Okay.
And I was like, honestly, doc, what was that about? Like, why didn't you answer my calls? So I'm just trying to express my disappointment.
Yeah.
And he's like, truthfully, I didn't answer because I thought you wanted to tell me you want a CS. Like, so he saw my call coming in and he ignored. He saw another call coming in and he ignored.
He saw your mother.
He saw my mother's call coming in and he ignored. Because he made the assumption that because I'm a doctor, small labor, I will start asking for a CS.
And so what if you did?
I'm stuck on two points. First of all, me, I'm still stuck on. Sasa, this one doesn't know she's in labor. Me, excuse me. And then number 2, okay, fine. Even if you're assuming that I'm calling because I want a CS, we can't have a conversation.
Right.
He was like, no. For him, I guess it was like, unless it's a medical necessity, I'm not doing it. Like, because of pain? No. But that's not even why I was calling.
Is that question mark negligence, or am I just using big words? Because I'm like, how can you not pick your patient's call and they're in labor and you left them there? You're the one who put
the calls, like that's the one. Ata afadhali angesema he was in theater or he was busy with another patient.
Or even just say, what's happening? Like, Yani, you've made a full assumption about me. In fact, actually, assumptions were made about you from beginning to end. From beginning to end.
Now I'm really understanding like why that was such a traumatic experience.
Yeah.
Because the story in itself is very traumatic, but also just how your gynecologist handled you.
And we've been together for years.
I'm so sorry. And this is what I tell a lot of people. When you've carried a baby, it's already a very sensitive period. But when you're going to labor is the pain part and delivery is the baby, right? I feel like you're so close to death.
You are.
At so many instances.
My goodness, you are.
So I had really weird experiences with doctors. Like my first doctor was a much elderly practicing lady.
Yeah.
And she was telling me things which might have been applicable, but it was the wrong time for me to hear them.
Wrong timing.
Yeah, wrong timing. Like she was telling me things like, the baby's yours 100%. Your husband is never going to help you with anything. I hope you're ready for this. And she's like, are you ready to shoulder it all by yourself? And I understand what she meant was, I'll be the primary parent, which I am. But there's a way to say it in the right context.
Yeah.
So I had a horrible experience with her. I had to find a second doctor who basically, like Dr. Maureen, is better, nicer, gets me more, because I was like, I'm not trusting. I'm not going through that life and death, very precarious situation with somebody who is not in touch with me as a woman, before even me as a mother, before me as a medic, because those are 3 layers to us, especially.
Yeah. Well, that's true, by the way.
And
no, ni reality. We have to tell you the reality.
Yeah.
And I think my takeaway, and whenever I meet mothers who are pregnant, especially the excited ones, who are always telling me, I want to do this is my plan. I always tell them, have a plan. But please just be as open-minded as possible. And I always tell them the most important thing, whatever goes wrong, because most of the time something will be a bit off. That you come home with a baby. Don't come home without a baby. We want you home and we want the baby home. Anything that happens between you entering that hospital and you coming out, good or bad, we just want you, the both of you, to be at home.
Be home.
Because there are so many situations where you go in and you don't come out with a baby. That is one of the most painful.
Extremely. So now, conversely, my second delivery was the complete opposite. Like, despite the complications, I was so supported. So I went into labor at home, and let me mention that for my first labor, I had what's the word when it happens quickly? Precipitate labor. So I had precipitate labor. Remember, I'm a primey, but they've judged me. Like, how? So with my second one, I was very conscious about it. So when I started feeling like the discomfort, I said, let's not risk. Let's just go. Ilikuwa usiku, about 11 p.m. But then I called my doctor. I told her, hey, I'm feeling some type of way.
What? The doctor picked.
On the first call. She says, okay, you're on the way to hospital?
Yeah.
I'll be right there. And sure enough, 30
She was right
minutes
there.
after my arrival at the hospital,
Yeah.
she walked in.
Nice.
So already I'm feeling relaxed.
Yes.
I'm calm. And so they check me.
Mm-hmm.
Mind you, by this time, I'm not in pain. I'm only in discomfort.
Yeah.
But when they check me, guess how many centimeters I was?
4.
6.
I was gonna say
A
9.
whole 6 centimeters. Discomfort
Yeah.
too.
You're blessed and highly
Discomfort.
favored.
For sure. But God was just like, hey, my sister, not again.
Not
Yeah.
again.
Yeah.
So I tell them now, please just confirm
Mm.
that the baby is head down, because the last scan showed
Again,
that it
you
was
were hard.
I was hard.
Mm.
Eh? So she came, she checked. She even called her colleague. She checked, confirmed. The confirmation was wrong, but that's not the point.
The thought counts.
Yeah. They said it's okay.
Yeah.
Baby's head down.
Mm.
And then the doctor took me to the delivery room.
Mm-hmm.
Then the
A
doctor
bit
checked.
cheeky, because she knew what she wanted to do. She wanted to break my waters.
And
Like,
that, by the way,
wait.
makes
It
labor.
augments. Now
Yes, it
that's one
augments.
a form of augmentation.
Yes.
Correct.
When your waters are broken,
Mm.
hey.
Pain.
Hair?
Yeah, it goes from 0 to 100.
Aye, my friend. Hair? Sikuwa najijua.
Okay.
Anyway, she confirms that the water is clear.
Yeah,
That's actually what
a
she
good
wanted to
sign.
know.
Mm-hmm.
The water is clear. Baby's heart rate is fine. But then she was not too happy about the heart rate. Like, she was like, it could be better. It
Yeah.
could be better, so we'll monitor.
Okay.
We'll monitor. She asked me, do you want us to give you the drip? I said, no.
I'm worrying so much.
Hell no.
No.
It's already picked. Again,
So
you
she
were
leaves.
hard.
I was
Sorry, let me just make a point.
No, make the point.
Make the point. Let me
Make the point.
I'm going to summarize when you're done.
Yes.
So she leaves and tells me, I'm in the area.
Yes.
Don't be afraid.
Vicinity.
Nico vicinity.
Just around.
Yeah.
Hey, the pain, the labor. Ooh. 1 hour later, I'm like, no, guys, this is it. This is it. This is. And remember, I got to the hospital like it's been less than 2 hours, but already I'm feeling,
I'm ready.
the baby is
Yeah.
here. The baby is actually here.
Yeah.
So the nurse comes, she checks,
Mm-hmm.
and then I ask her, can I be on my 4s? By this point now, the doctor has come.
Mm-hmm.
The doctor says, yeah, you want to be on your 4s? Go ahead.
Should I say it again?
Go back to you.
She was hard.
I was hard.
Action.
So I'm on my 4s on the bed.
Uh-huh.
Nice.
And the pain, my God. She says, okay, now I have to check. Now I have to check you. So she checks and then she keeps quiet.
Bam bam.
It's feeling like a butt.
I'm like, okay, just
And
just
butts,
tell
by
me.
the way, butts and heads are very hard to differentiate. Let's
But
be
imagine-
clear.
Yes,
But
yes.
legs,
What if they had
legs
kaput?
and head are very easy to differentiate.
Oh,
so
yes,
some
yes.
briefs, some breeches is the feet.
Yeah.
And some breeches is
It's
the,
the
bum.
bum. Yeah.
So
And so that's why
Yes.
it was very difficult to
Yeah.
differentiate.
Yeah.
So I don't fault them for that.
Yes.
Because they were there and they were checking.
And they brought
Okay?
someone to confirm.
Exactly.
Yeah.
Hey, she tells me now, your breech. I said, what? But I told you guys to check. But see, I told you. She says, no, it's okay.
Yeah.
Let's just prepare for theater. But she's very calm.
Assurance.
So calm.
Mm.
She says, it's okay, let's prepare for theater. And then she keeps quiet and comes closer to me. It's like,
Mhm.
this is your second baby.
Yeah.
You're fully dilated. You're fully
Yeah.
dilated. Baby's a bit high, but you're fully dilated. Let's give it
try.
a try. Let's give it a try.
Mm.
So you're the pediatrician has come.
Please, let me stop here and add something very important.
Add.
The doctor told you, like it was a conversation.
Yes.
It wasn't doctor has said,
Yes.
which I think sometimes medics are horrible at.
Yes.
So it was, are we in this together?
Yes.
Are we on the
Yeah.
same page?
Let's
Not
agree.
pushing the doctor's agenda.
Exactly.
But
I love it.
pediatrician has come. The whole team is there.
Yeah.
They're ready.
Yeah.
They're ready.
Mhm.
So I'm not even panicking.
Wow.
I'm like, at Nikki blackout say, I know I'm taken care of.
Yes.
Theater is right next door. I tell a doc, tell me what you want us to
Let's
do.
try.
Let's go.
Yeah.
Whichever method will remove this baby faster. Please, I'm here for it because this pain is too much.
Yeah.
It's too much. Already now when I reached, I couldn't get an epidural because I reached
Yeah,
at
you're too
6
late. Yeah.
centimeters.
Yeah.
Yeah, epidural. Ni kama
utaionja. Yeah.
It's
Gathoni, you might. Oh
no,
no.
it's not for
Ni
me.
kama hata wewe utaionja.
It's not for me.
Over to the next, not me. Over to the next person.
So anyway, I said, yeah, let's go ahead. now she says, okay, now I'm giving you the drip.
Yeah.
This one you don't
To
have
help,
a choice.
yeah.
This
Yeah.
one you don't have a choice because you're full, but baby is a bit high.
yeah.
So it will help the baby
Yes.
to
So it will
drop.
help the baby to drop.
Mhm.
And true enough, Jesus Christ.
You felt it, eh?
You're like, this drip is
As
woo.
soon as that drip went in, the baby dropped, descended.
Because the uterus contracts.
Descended.
Fiercely.
Now she
Kwanza,
tells me,
they they count with drops. Remember when we used to
Yeah.
do internship? How many drops do we do?
Yeah.
6, 12.
this one they must have just
Hey.
funguliad.
But even that thing, counting the drops at 3
It's
a.m. in the morning,
difficult.
you're just there
It's
like,
difficult.
oh my gosh.
So she tells me push. So I start pushing. I push. Hey, you know how there's ring of fire?
Mm-hmm.
And now this one is not a ring because it's the whole
It's
trunk.
it's the trunk.
It's the whole trunk.
Damn. Did you tell your episiotomy again?
Now she told me, did she give me an episiotomy? Yes, she gave me an
Yeah, it should have been a
episiotomy.
good
Said
idea,
here,
You'll
because
need
it's
it.
Yeah.
breech,
Yeah.
let's do it. I agreed. I said, fine. Oh, whatever you tell me. Me, I'm
Yeah.
agreeing.
Again, you see, your agreement
Yeah,
between the
and
two.
you've been asked.
Yes, and you've been asked.
Yeah.
Yes, counseled.
Yes.
And so about 10 minutes into pushing,
Yeah.
baby was out.
Nice.
And of course, because it's breech, everyone was very ready because there's a high likelihood of needing to resuscitate the baby. But Mungu ni nani? The loudest cry
Yeah.
ever.
Kwanza, we should talk about that feeling when your baby cries the first time. There's nothing like it.
Nothing.
Okay.
Allow me to just deviate
Nothing,
kidogo.
please.
Me, the second I get pregnant, positive pregnancy test, I have subconscious anxiety. Will we reach 9 months? Will we miscarry?
Yeah.
Will I lose you? Will you not make it to the other side? As in, the what ifs between the positive pregnancy test and the day of birth, the two in me, in my mind. And I'm not projecting, please.
Yeah.
There's so many. Then you're carrying, you can't do stairs, you can't eat sushi, you can't take sauna, you can't you're so
Yeah.
restricted.
Yeah.
So you're mindful that you're sensitive, right? So then you get to labor and delivery, again very sensitive. But when you hear that baby cry, you're like, we made it. I don't even thank my husband. I thank God. I'm like, Bongo, this thing.
Thanks, by the
As
way.
in, that anxiety, it just has like,
Yeah.
we are here.
Yeah.
Best feeling.
So good. So he cried and cried.
Yeah.
And kept crying.
Yeah.
Like he actually would not be quiet.
And you're just like, yes.
I'm
Yes.
like, keep on,
Hey.
open
Praise
those
God.
lungs.
Yeah.
Open them.
It was worth it.
Yes.
Yeah. So he didn't
Yeah.
even need to go into the like nursery or NICU or anything. He was fine.
Yeah.
The doctor came and stitched me. Of course, she gave me local anesthesia.
Very
So I
important.
didn't feel pain.
Again,
And can we talk about
different.
the kind of
Important.
work that she does?
Oh.
Compared,
Hey.
compared to a butcher in theater who is just like,
Some people,
Dr.
they're working-
Maureen.
people are working on their skills.
Aye, please receive your flowers.
hey.
Because a few weeks or months later, I can't remember, my first works now post delivery, my waxing lady tells me, ati, hey, na hii this time imepona haraka.
Okay, the way other women know each other's bodies.
I said, that's my doctor for you.
Wow. That is
It
amazing.
literally healed so fast.
Yeah.
What an amazing experience.
Amazing.
That's
Amazing.
really nice. I think we're seeing the differences between how things happening in the way you didn't plan and just how your handle can change, you know, how you
Can
go through
change
the
so
process
much.
and even just the outcome, because the outcome is now you're a mother who's like really ready, you know, to hop on this new journey.
And also
Like, let's
finding
start
the
well.
right people to support you through.
Yes.
And it's not always hospital-based. Sometimes it's a doctor.
Yeah.
And the one thing that I always like to do whenever we're having these kind of conversations is to try to make this practical for somebody who is based in, I don't know, let's say Thika,
Yeah.
and going to the nearest maternity-based hospital where they don't have a primary doctor. They don't come with a gynae. Whoever you meet is who you meet.
Yeah.
How can we help them to have the same experience that
Ngendo
Doc has had
had?
on her second
Yes.
experience? I think my advice might not be so good, but I would actually say be a difficult patient. I find that
Advocate for
difficult,
yourself.
yeah, difficult patients get
Yeah.
more care from nurses and doctors than the ones who are calm and quiet. If you have a husband who is always badgering us at that nursing station, wananipigia kuniambia, ebu kute one this mama.
Yeah.
Yani msort tu na haraka aende. So I'm trying to see how can we help the everyday woman
Yeah.
to have a very good experience during giving birth. Make noise.
And I
That's the only advice I
I don't
can
think
give.
it's being a difficult patient. Okay, fine. We see them as difficult patients, but it's just advocating for yourself. Advocate for yourself, speak up, ask the questions. And I feel like for me, this is the reason I do this, because it's very easy to have a conversation with someone who understands what you're saying. So Of course, do your research as well, but don't just yes.
Yes.
Ask why.
Ask
Find out,
questions.
okay, fine. So you said I need to have an episiotomy so that you can follow up even later. Okay, fine, doc, I had an episiotomy. How do I manage this episiotomy? You know, so it's continuous care and not just care for that moment.
Yeah.
Or if you know your baby's going to be big, like how mine was big,
Yeah.
know going in, you're
Yeah.
going to need an episiotomy or you're going to have a tear of some sort, especially babies over 3.8. The likelihood is
Yeah,
higher.
it's high.
It's not a must, but it is. Rich babies, you need an episiotomy. So like you said, education is important.
Very important.
Don't go
yeah.
into labor and delivery without that basic
Basic
Google
knowledge. Yeah.
knowledge. You
Yeah.
don't have to have a medical
And there's a lot
degree.
of information out there.
Yeah.
Even and
It needs to
we
be
are doing part of that.
credible. It
yeah,
needs to be
I
credible.
know.
Yeah.
Yeah. But we are educating people.
yeah,
and
true.
and that's one step towards
Towards
supporting
and
mothers,
empowering.
empowering mothers.
so that you have good birth experiences. Birth is
Yeah.
already so difficult. Let it be a good experience.
Even the smoothest delivery is
challenging.
traumatizing.
Yeah.
Now imagine a traumatizing one.
Yeah. Some people don't want to go back, by the way.
I can
my
see
gosh,
why.
Just because of the way you're handled. I'm
Yeah.
actually, you're such a strong woman. I've said that so many times. The fact
Yeah.
that you went back again,
Imagine.
kwanza so soon.
Nilijikuta.
So soon?
Nilijikuta tu.
Let me tell you guys, I'm actually so happy the direction that we took with this conversation because I think it's feeding into the narrative that your voice really is very important and it can really influence your experience and how you transition. Like even now, because you're moving from pregnancy to postpartum. And I was saying many women are entering postpartum from a traumatic experience.
Already.
Yeah. So of course it'll manifest in postpartum.
Of course it will.
Yeah.
Of
So this was
course.
actually a nice twist. Sasa next season, ama the other one,
To-
lazima we talk about the
anytime.
babies.
Yes,
Anytime.
first 1,000
The
days.
babies,
We're
yeah.
ready.
And we
We're
also
ready.
need to talk about why nursery and maternity ward or postpartum ward are not on the same floor.
Or near each other in some
Or near each other.
in some hospitals.
You have to traverse
Kwanza, you know the way the
absolutely
labels
no
are on
sense.
babies.
cross counties.
Do you know the way labels are on babies and stuff? It's like it's so easy for things to go wrong. That's why there's so many circumstances.
Yeah.
But again, when you're picking a hospital, hopefully, can my baby stay with me? Can my baby stay with me? Those
Actually,
are very
do your
important
research.
questions to ask.
Yeah.
Yeah.
So let's save that one for the next one.
No
now
problem.
to wrap it up, and we're closing the season. So this is what take-home message do you want to send to a mother? Ngendo, it's always a mother to be, aspiring mom, a mom that is near labor and delivery or has even delivered. What advice or what take-home message do you want to share to this mom?
A lot of it has been said already, but let me just emphasize, advocate for yourself. Please, if you don't feel comfortable about something, let it be known. Advocate for yourself. If you are anxious about something, please just talk to someone. Call anybody, call a nurse, call a doctor. Just express those anxieties. If you have a good support system, lean on them. Yeah.
I would add something a little bit different. And it's also especially an encouragement to new mothers. First-time moms who are going into labor and delivery, take the time to know your body, but most importantly, trust it when you're going into labor and delivery. Just like what Dr. Nyendo said, she knew at the back of her mind, this is not 4 centimeters. There's something in you that clicks. Where I've reached, it's
not the math is not mathing.
You don't,
It's not
and I
mathing.
had a similar experience as well. The math wasn't mathing. I was like, here, something is wrong. I'm further than what they think. So trust your body. God has given us this. I don't know if it's intuition. I don't know if it's Holy Spirit. There's a something. There's a something that speaks to you from that time until your baby, by the way, continues to live. Or it continues to grow. So I feel like trust that voice very, very strongly. It will help you. It will help you.
It will.
I think for me, first I've learned so much just from this small series. And first of all, one thing I'm learning is we cannot exhaust pregnancy. We cannot exhaust the whole motherhood journey. We just can never exhaust it. So tutaipangia. But something that I have learned is even as you're going into not just labor and delivery or postpartum, even pregnancy, it's good to be inquisitive, to ask the questions to your doctor, to have a plan or work with them to map out a plan. try and understand what are some of the complications that can come about. How do I prevent myself, one, from getting these complications? And if you get the complications, how will we work around the complications? And then the same thing, even as you're going now into labor and delivery and postpartum, because now you're coming from a prepared mind. So things won't be taking you by surprise. And also the anxieties, of course, anxiety will still be there, but it won't be so high. Yeah. So I think for me, just inform yourself and also make sure your doctor is informing you. Don't leave the one clinic visit without learning something.
Yeah.
Like, it's not just, okay, fine, ANC profile, is the baby kicking well today? Is the
Heartbeat is
heartbeat okay?
okay.
No,
Yeah.
try and learn something from each engagement or interaction you have with your healthcare provider, a fellow mom, a fellow father, your support system, just so that you're constantly learning and preparing for the journey ahead.
Can I add something? And Dr. Kenya is really good at doing this, is creating a birth plan with her patients. So as a patient, a mom to be, birth plan is so important. And I think we don't tell our patients enough how much they need it. I don't know if it's like, are we lazy? Do we not want like too many, like nitty-gritties?
I think it's just
But
new.
you're right. You actually do have a right to sit down with your doctor and have a birth plan and have them stick to that birth plan.
And the birth plan
Your
will
camera
have
is
things.
there.
The birth plan will have things like epidural, yes or no.
Yes.
Yeah.
When are you
Will my doctor
comfortable-
be there?
Yeah.
Yeah.
Just like what the things that they talked about. Are you comfortable with IV drip augmentation? Small things so that both of you have the thing. And then you can share with your partner or your support system. So everybody's speaking from the same script unless it's an emergency.
Exactly.
In an emergency, it's even written that in an emergency, doctors' right judgment call will
Yes.
be the one to go
Yeah,
ahead.
to make the decision.
Yeah.
Yeah. I've actually remembered something. You see the way there are certain types of vaginal delivery that are done in theater because
Yes.
it was called expected delivery. What was it called? Like where it could lead to a CS.
Oh yeah.
It was
Like the ones
expected,
where they use
prepared.
forceps
Vacuum
and things like
forceps and
that.
all that.
Probably they'll use forceps or vacuum,
Instrumental, like.
but there was like the whole process had a name. I think it was expected preparedness. Okay, I'll remember and put it here.
Yeah.
And how I look at it is normally that's just for us, the healthcare team, but let's have this also for the mom as well. Yeah, so you come in with this preparedness that it could go this way, it could go this way, but for whatever scenario, we have some sort of preparedness.
Or the best plan possible, the best optimal situation, the best plan. This is what we'll do. If it doesn't work this way, then we
Plan B,
discuss
plan
other
C.
things.
Yeah. Okay, guys.
Oh
Hey,
my
that
gosh.
was so.
Oh my gosh.
That was yummy.
Thank you.
Nabado.
Yeah, Nabado. Thank you for
First
having
of all,
us.
I've seen. So this is a perfect pairing.
It's a good combo.
I like. This I like.
Yeah.
Ngendo suggested. Actually,
Oh,
I was
yeah?
like, I'm
Okay, thank
looking
you for
for.
thinking of me.
Yeah.
Of course.
I was just like, you knew why.
And our stories are similar but different. So
Yes.
it's actually quite interesting.
Yeah,
And I think our kids are on the
And
same
I've
page.
honestly, I've really
Yeah.
enjoyed. Mimi, this has been yummy to eat.
But can we also give you your flowers? 2 seasons in.
Hope
Hey,
you've
we're
done
happy to
so
be the concluding
well. I know.
finale
The
episode.
finale.
Thank you. Thank
If
you.
I
Thank you for you. Well
if
done.
I
You've done
just
so well, Hopi.
Well done.
So well.
It's not
Thank you
easy.
so much.
Yeah.
You know that thing for just do it. Like
Just do
whether it's not perfect, just do it.
Yeah.
So
Do it.
it's been a learning journey, but it's been an exciting learning journey.
Wonderful.
Yeah. So I'm happy to be here.
Too many
happy
more.
to have you guys
Too
to wrap
many
this.
more.
Too many more different stages,
And
different
more
platforms.
growth and
You know?
success.
Yes.
Wow.
Amen. Amen. From your lips
Hallelujah.
too.
This thing
Amen.
started on IG in the Haka.
It did.
It was the actual car where you
Yeah.
were taking us on daily.
Yes.
Now look at us
Yeah,
now.
now I'm struggling. How do I give this one attention and give a dose of health hey,
Don't worry. Those are good problems.
and
Those are
that's
good
good
problems to
have.
have. We thank the Lord.
We do. And now because we want to find you, where do we find you? Plug yourselves.
I am on Instagram, Dr.Dee Mburu.
Mm-hmm.
Yeah.
Okay.
Same. I'm on TikTok as well, but Instagram is mainly where you'll find me. I'm at the Medic Mama.
Okay. We'll put your handles, don't worry. Now, because I've been told to wrap up because we've yapped for long. Dr. Hope
loved
Simiyu. My handle will be somewhere here. A Dose of Health, the podcast. Find us on TikTok, Instagram, YouTube, Spotify, Apple Podcasts, AfriPods. And please watch the other episodes.
Yes.
Engage with us. Comment, share, like, subscribe. Izo zote.
Everything.
And join us for next